As a former patient who's been transferred throughout the many divisions of the healthcare system, I would like to say thank you to all healthcare providers and professionals. My path to the medical field began 1 month after I graduated high school in 2004. I was on my way home from swim practice and was involved in a near-fatal car accident. The injuries were catastrophic. My heart shifted across my chest from the impact of the crash. Lungs collapsed. My pelvis, ribs, and left clavicle were shattered. There was damage to pretty much every major organ. Failure of my kidneys and liver, removal of the spleen and gallbladder, 60% blood loss, severe nerve damage to my left shoulder, and I was in a coma on life support for over 2 months. Throughout this point in time, I had to be brought back to life several times. During the coma, I underwent 14 major operations, received 36 blood transfusions, and 13 plasma treatments. I was unable to move or talk, but I could often hear and see in my paralyzed state when I was being weaned off the heavy sedation. Due to the concussion I sustained in the accident, there was no memory of that actual day, so I had to depend on my parents and healthcare team to understand what happened to me. Progress slowly continued, from regaining the strength to blink, move my fingers, wiggle toes, chew ice, and then to the point where I relearned how to talk again. After spending a few months in a wheelchair, I took baby steps to walk on my own. It was a miracle that I could walk again, but I wanted to push even further. I wanted to get back in the pool again. Before the accident, I had 3 short-term goals: to go to college, swim on the team, and to one day compete in the Ironman triathlon. After several lung tests and a few months for learning how to swim, I decided that I was not going to let my injuries stop me from living my dreams. 6 months after that, I began my freshman year in college. 2 years later, my third goal of competing in the Ironman took place on October 13th, 2007. Throughout the completion of these 3 goals, I had continued support from my care providers. Now that the healing was complete, I wanted to become a healthcare advocate and represent the patient experience. I went to my hospital and gave a presentation where I shared my story and thanked everyone. And then my story spread to the local hospital association. Later that year, I was presenting throughout the nation. I continued sharing my story in the healthcare field, to my surprise, all throughout the world on topics that relate to the patient experience, patient safety, quality of care, communication, and innovation. I have a variety of columns where I write about healthcare, have published 2 books based on my experiences, and I've also consulted on many patient safety programs. This personal mission that I've been on is about sharing my experiences and my appreciation to the people who have chosen a career in this life-giving field. Every patient has a story and an experience, and the observations that I made during my time in the hospital helped me understand how important the roles of communication and teamwork are between the patient and healthcare provider. There is a support system that exists in each hospital room, and my favorite care providers, my dream team members, always came into my room with a positive energy, made a connection with me, showed compassion and empathy, held my hand, got to know me and my family, and believed in me when I didn't have the strength to believe in myself. My healthcare advocacy is based on these experiences, and it's so meaningful to be able to share my story and appreciation with care providers because, in my eyes, they don't get enough credit for what they do. Saving their patients, saving hopes for the future, and saving families. The power that healthcare providers have is extraordinary. On a daily basis, they're not only caring for the health of their patients, but they're also creating reasons to smile, making living conditions suitable and pleasant, and forming connections with these people who not only need them, but depend on them. This is a message to all healthcare providers. In whichever part of the hospital and healthcare system that you work in, thank you so much for choosing this path in life and for all that you do on a daily basis for your patients and their families.